Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, January Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Jim Adams, Health Commissioner for Canton City Public Health. Good morning, Jim, and welcome back to the show.
Morning, Paul. Good morning, Brad. Good morning, Canton.
When COVID-19 pandemic hit the U.S. in early 2020, it felt scary but temporary. Wow, that seems like a long time ago. All these months later, we're feeling stressed, frustrated, and perhaps angry over that it isn't over. On top of that, it's difficult to feel like we're getting clear, consistent information to make the best decisions about our health. This morning, we are fortunate to share this time and space with Jim Adams to share the facts and current recommended guidance regarding COVID-19. We also want to thank Jim and the staff of the Canton City Health Department for their tireless efforts on behalf of the health and safety of the entire community. Thank you. We'd like to remind our listeners this morning that this program is also available on our podcast. You can look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and we would love it if you would please subscribe.
So, Jim, welcome back to the show again.
Welcome.
And tell us a little bit about yourself and introduce yourself again to our listeners.
Sure. So, Paul, I'm the Health Commissioner for Canton City Public Health. We're one of 4 health departments located in Stark County. I've been in public health since 1997, if you can believe it. Started at Canton City Public Health in 1985 as Environmental Health Director and have been the Health Commissioner since 2008. My training is actually in environmental health and epidemiology. I'm not a physician, but I do have really a wonderful staff to support all the efforts that the health department has regarding COVID and all the other things the health department does to help keep the community healthy. I've also got a special power, and that power is my wife. My wife is a registered nurse, but she's also certified in infection control and epidemiology and had a long career in infection control. So you can imagine our dinner conversations regarding COVID and keeping me on the straight and narrow. So, with all that support in the community, we hope that we can really help people make good decisions and make those kinds of decisions for their health that you mentioned.
Could you ever have imagined this scenario we're in right now?
No, but we prepared for pandemic of a pandemic of a respiratory illness for many years, and early on we thought it would be what we termed the bird flu. We've heard that term before, and so the plans for dealing with the pandemic were not unknown, and we have actually practiced this. But to see it play out in real life is, as you can imagine, much different than the planning scenarios.
As you know, the news about COVID seems to change almost by the hour. So today here is a lot of talk about the Omicron variant. Can you give your listeners an update on the status of this pandemic, both globally and in our community?
Sure. So, the numbers are staggering. Yesterday I looked up some current information, and the World Health Organization is reporting, as of yesterday, 312 million cases of COVID in the world, 5.5 million deaths due to COVID. In the US, the numbers are equally large, 62.5 million cases and almost 900,000 deaths. An average daily incidence rate of 761,000 new cases a day. So that's pretty significant. Ohio and Stark County reflect that. In Stark County, we're seeing about almost 4,000 new cases in the last 7 days. That's a case rate. We use that to help compare over time periods of a little more than 1,000 cases per 100,000 population. So that's a very significant number of new cases. It's interesting to note, we might talk about testing later in the program, but our positivity rate for testing right now is around 25%. About 2 weeks ago, our positivity rate was about 12%. So there is a lot of virus circulating in the community right now.
So I know our hospitals are full, so I'm told, almost at all times. What about, we can have a quickie discussion here about vaccinations and boosters. First, vaccinations. What are the current recommendations for vaccinations by age?
Sure. So, everybody over the age of 5 is eligible for a vaccination product. So we know, of course, it varies by manufacturer, the age recommendations, but really any person 5 years or older is eligible to receive COVID vaccinations, and we strongly encourage that. People that are 16 and over can get booster shots, depending on the manufacturer. And additional doses are also recommended for those that are 12 and over that may have other immunological conditions. So really, vaccines are widely available. There's not many contraindications to vaccination. There are some, but it's widely available for those 5 years and older.
So if our listeners have already been vaccinated, what are the recommendations on the boosters?
Yeah, so that's changed a little bit. So there has always been a recommendation for what they call an additional dose. So for some people that are immunocompromised, the 2 doses of the 2-dose regimen may not be enough to confer immunity. So they were always eligible to get additional doses. But for booster doses, that's been reduced from 6 months to 5 months. So we are recommending booster doses 5 months or older for most people. If you got your Moderna vaccine, the booster doses are recommended for people that are 18 and over after 5 months. If you've got Pfizer vaccine, recommended booster 12 years and older after 5 months after you complete your primary series. And if you got the J&J vaccine and you're 18 years and older, they recommend a second dose 2 months after the completion of the J&J vaccine. CDC is recommending that you consider getting a second dose of an mRNA vaccine, which is the Moderna or Pfizer product.
Gosh.
Yeah, it's
okay.
very complicated. Yes. Yeah.
we need a chart on the wall.
Mhm.
Okay. So, all right, the big discussion and concern is about vaccinating children. Current recommendations are, and can you address some of the concerns floating around about vaccinating children?
Sure. So we do recommend all children 5 years and older get vaccinated for COVID as part of their regular vaccination series. Also recommend that children 12 years and older, if they're vaccinated with the Pfizer product, get a booster when they're eligible. And this is consistent with other vaccine recommendations. So as you well know, there's a variety of vaccinations that are recommended for children to protect them from vaccine preventable diseases. There are very little serious side effects related to vaccination of children with the COVID vaccine. There is some concern over the Pfizer product for kids that are around the 16-year-old age about a myocarditis, but we do have 2 products that we can choose. One is Moderna and the other is Pfizer. So, people need to consider, those and the risk benefit that they're taking for those vaccines. But we do strongly recommend all children 5 years and older get vaccinated.
Okay, many of our listeners may have heard the term flu-rona. What is flu-rona and how important is your annual flu shot this year?
I will tell you, I had not heard that term until you asked that previously. So I thought that was pretty interesting. Yeah, so according to the be all that knows all, the internet, flu-rona is a combination of a flu and coronavirus infection at the same time. And so we do know that this is shaping up to be an average to worse than average flu season. We've already got flu virus circulating in the community. We've had hospitalizations that are due to flu. So flu vaccination is and continues to be very important for the prevention of serious respiratory illness. There is no reason that you cannot get a COVID shot and a flu shot at the same time on the same day. So flu vaccination is still very important.
That's been a common question in the pharmacy of if you can get your both shots at the same time. So I'm glad you brought that up because it is something that we've done frequently. You just got to use separate arms generally. So,
yeah,
but
absolutely.
It's not a hard thing, and it saves you a trip to the pharmacy and hopefully gets you double protected. So we've had a lot more interest, obviously, in flu vaccinations at the pharmacy level than we did in last year. So, we still have some flu vaccine available. So if you haven't gotten your flu shot, you can certainly come in and we'll fix you up.
That's good. That's good.
So Omicron, I feel like, if you're a stock trader, you hear all these Greek words and you think that, maybe it's a new type of indicator or something, but Omicron's the current variant. Can you talk about some symptoms and how they may differ from Delta or if they differ at all?
Yeah, so that's pretty interesting, So as I pointed out before, I'm not a physician. So if people really have questions about symptoms and whether they're symptomatic or not, they really need to have a conversation with their healthcare provider. So, but according to the CDC, at least, the classic symptoms of coronavirus infection are cough, fever, general aches and pains, which is malaise, shortness of breath can occur. A lot of people experience a loss of taste and smell. There's not many respiratory conditions that result in the loss of taste and smell other than coronavirus. So that tends to be kind of a hallmark symptom. But with the Omicron virus, it looks like it's affecting the upper respiratory tract more than the lower respiratory tract. So added to those classic symptoms are stuffy or runny noses and a sore throat. So that becomes, symptoms that are very mild and can be confused with many, many other respiratory illnesses. So it makes it very difficult to diagnose just on the basis of symptomology alone.
Is Omicron more dangerous than other variants?
Yeah, that's a good question. And it's kind of got a yes and no answer to it. We do know that what we do know is that the evidence shows that it's probably a less severe form of illness that doesn't make it mild. No mistake that coronavirus infection, even with Omicron, still can be a very serious illness, particularly for those that are unvaccinated. And so it is still very important to pay attention to it. What makes it of a concern is just the sheer number of people that are being infected. So if you can imagine, let's say 1% of the population ends up with a serious illness from the Omicron variant. The sheer number of people, if you double and triple the number of people that are getting ill, you're still going to double and triple the number of people that are seriously ill. So that is one of the reasons we were seeing the surge, is just so many people are getting an infection. It's not more, it doesn't cause many more severe illnesses, but it does cause just a sheer volume of number.
Okay, Jim, time for the first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Flu vaccine, along with Moderna and Janssen COVID vaccine, are available in our stores. Please stop by any of our stores to get vaccinated. No appointment is necessary.
Okay, before the break, we were talking about vaccines, and we were talking about Omicron and its symptoms and how it's more infectious than Delta at this point. How are our vaccines performing against the Omicron variant?
They're doing really quite well. The effectiveness is a little bit lower. Our immune system is a little less efficient at dealing with the Omicron variant, but it's still highly efficient. Our COVID vaccines are really nothing short of a miracle. We've transformed the COVID infection early on from a brand new infection to a vaccine preventable disease in less than 1 year. And so these vaccines are generally safe. They're widely available, and they're still quite effective against preventing serious illness, hospitalizations, and death. And so it's still very, very important to treat it with respect and use all the available tools that science has provided us to help deal with this infection.
I had someone ask me a question yesterday that was referring to, if the vaccines are so great, why do we continue to transmit coronavirus, and why do people continue to get infected if they had a vaccine? And frankly, all I can think about is the flu. Just because we have a flu vaccine, not everybody gets it. So flu is still transmitted, and you can get a flu vaccine and still get the flu. But generally, even if you contract COVID and you had a vaccine, you generally don't have as bad of an infection. There's certainly outliers for other reasons, but I guess I thought it was an interesting argument, but at the same time, I think it was grasping for an explanation for justification of not getting vaccinated, which was disappointing. So,
yeah, and I think about is a lot of it is maybe our own lay misunderstanding of how our immune system works and how vaccines work. They don't guarantee 100% protection against an infection. So there's this varying response. Our bodies all react slightly differently. So I think, there might have been some expectation that, you get a shot and you're good and you can walk away and never have to worry about it again. But, if we reflect on that, we know that that's not true for any other illness. There's always a risk. And so vaccination is a way of help managing that risk and managing the chances of you of getting a serious infection that could result in hospitalization or death. So It's not 100%, but it really goes a long way to lowering that risk.
What about, it seems like we are having some more breakthrough cases than other variants. What do you feel is contributing to that?
Yeah, so, from some of the early studies show that these changes we're now experts, right, in the way proteins look and act. We've heard the term spike proteins and, all those kinds of things. So, there's been, significant changes in the Omicron virus, and it is a little more efficient at evading some of the defenses that our body has to fight off infection. So it's able to, it's just able to kind of be in our body and avoid those things that we have to fight off infections. So that's part of the reason for the breakthrough infections. The other reason is that there's just so much virus circulating right now. So most of us are being exposed on a pretty regular basis right now.
It's my opinion, but it seems like, it certainly seems like there's the belief and some proof to know right now that a lot of the kids are carrying coronavirus and passing it around because they either aren't eligible to be vaccinated yet, or they've been kind of the last mile, if you will, to be able to get approval to vaccinate. What, you touched on the guidelines for vaccination before. Do you have any anticipation or opinion on when we might see COVID vaccines indicated for children under 5 years old?
Yeah, we know that Pfizer is the most aggressive at submitting data and doing studies to try to drive those age groups down. So Pfizer has submitted information to FDA for approval for 2 and up. We don't know the timing of FDA's action on that. I do look once a week to look on their meeting agendas to see when that's brought up, and I have not seen it on the agenda yet, but we have seen news reports that they've submitted the data for review. Approval of vaccines goes through quite a lengthy process, and the first thing happens is the FDA actually authorizes the use of the vaccine. They made a determination that the benefits far outweigh the risks, that they have low side effects and things like that, and then it goes to another committee with a different agency, the CDC, and this committee that advises the CDC on immunization practices also debates the issue, and they're the ones that come up with the use recommendations, age groups, timing, and things like that. So it's a 2-agency process. There's a lot of checks and balances in place. Both these committees have standing committees of very skilled providers and practitioners and experts in the field. So it is not done willy-nilly, for sure.
Well, the risk certainly, nobody wants to put a vaccine out there and put a young child at risk. So, I mean, it makes sense to me, trust but verify and recheck. So, speaking of the contagious nature of Omicron, can we touch on masks for a little bit?
Sure.
I think it's interesting that the data is showing that cloth masks are not the best for Omicron compared to surgical masks, and then N95 seems to be the gold standard. What info can you share with listeners about best practices for masks and how to make sure they're safe?
Yeah, so early messaging on masks was cloth mask, use anything that you can possibly find. But as we've gotten more data, then of course our recommendations change. So some people are frustrated in the fact that information changes as we progress through the pandemic, but it's changed for a reason, and that reason is we've gotten more data and more information. And so we need to be willing to change our practices based upon what the data is telling us. So right now, with the infectious nature of Omicron, it's showing that a cloth mask is probably the least effective face covering that you can have. The best face covering it's showing is an N95 or a KN95. They are both, there are some technical differences to the mask, but they are essentially, very close in performance as far as, protection along that line. The second best is a very high quality surgical mask that has at least 3 layers. The real key is to make sure the masks are well fitting. And so they need to have the wire that goes around your nose. You need to take time to fit it around your nose. You need to avoid twisting the elastic straps. You've seen some people do that. They'll put a twist in the strap and it makes a gap in the side of the mask. The sides of the mask should fit tightly against your face. So the real key is to make sure the mask is well fitting. Avoid the use of things like a bandana, neck gaiters, things like that. They've shown to be the least effective at controlling the spread of the virus.
Okay, it is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist and host, Paul White. We're talking with Jim Adams, Health Commissioner for Canton City Public Health. A lot more to cover this morning, so let's get back to the show. So, what is going on with the tests that sometimes are available and sometimes aren't available? Tell us about the tests for COVID.
Oh yeah, testing. So, there is really a three-pronged strategy to helping control COVID. One is vaccination. The other is masking, like I mentioned. And, if I could just add a couple more comments about masking, it is a fairly simple process for us to use a mask when we're out in public. It's not really something that we should resist. It does help prevent against COVID and other respiratory diseases. I'm reminded that, make sure that pay attention to your mask, and if it becomes soiled or becomes wet, it loses its effectiveness. So, change your mask frequently. Don't use the same mask for 3 months and expect it to perform as well as when you first took it out of the package. So, pay attention to that. But the last strategy is testing, and testing is important because it will allow us to take actions based upon the results of the test. And unfortunately, in our community and in the United States, the resources for testing has never really matched what the recommended process is that we need to use for testing. So testing resources are limited. And so, if you do have the resources for testing, there are some guidelines for testing, but we still have to take actions in many cases without the knowledge of what our test status is.
Okay, so what should a patient do while they're waiting for test results?
Yeah, so if you are able to get a test, let's talk a little bit. We're going to talk a little bit of isolation and quarantine later on, but really the testing is used in conjunction with isolation and quarantine. So I've talked before, isolation means I for ill. So if you have symptoms or you have tested or have been diagnosed with COVID, you're in isolation for a period of time. If you've been exposed to somebody with COVID, then you're in quarantine for a period of time. Testing will, right now, it'll allow you to understand whether or not you are definitely have COVID or not. And so if you have been tested for COVID and you're waiting on a test result, you should be in isolation. And so you should be in isolation, which means you should wear a well-fitting face covering at all times. You should not go out in public for at least 5 days following the date of the test or the date of your symptom onset. And you need to wait to see what that test is going to tell you.
The test kits are most of the time almost impossible to find. And just, to me, looking at the process of making those kits, I can't believe it. We don't have millions of them laying around somewhere,
I hear your frustration. Yeah. And we are equally as frustrated. I've kind of had the opinion that if we spent the same amount of effort we did on Operation Warp Speed at developing vaccines with developing a robust testing strategy, we would be in a very different place.
So what should a person get tested at? Why should a person get tested after a known exposure to COVID? And how many times to get tested? Yeah,
there's no limit in the number of tests that you could receive. I would suggest that test supplies are very limited. So, I would not get tested just if I didn't have symptoms or I didn't know that I was exposed, just to see what's going on. Please be mindful that testing supplies are limited in the community, and every test you use is a test that somebody else cannot use that may really need to. It is appropriate for testing if you're under quarantine, if you want to try to get out of that quarantine situation earlier. With the CDC changing their recommended quarantine times from basically 10 days down to 5 days, people can get out and about in the community much sooner, even if they don't have a test. So, like I said, I think testing is could be an important tool if we had the resources to do it properly.
Okay, so I can't find a test kit anywhere,
right?
And I think I should have COVID. What's the game plan?
Yeah. So you need to, if you think you have COVID, then you should act like you do have COVID and follow the recommended isolation procedures.
Okay. Um, do we really need to know if we have COVID if we don't have serious symptoms?
Yeah, that's a very good question, Paul. And I think that kind of relates to what we were just talking about before. So, if you're able to manage your symptoms appropriately, if you can properly isolate and at home and manage your symptoms, you're able to access your healthcare provider, usually through a phone call or telehealth, something like that, then, your actual laboratory status is less important than treating the symptoms of COVID.
You know, it's almost an impossible situation with all these variants going on. And what do we got? Something news coming, I thought I heard. I thought it was interesting that I read a few days ago that the Israelis seem to be somewhat more advanced in following the vaccine, and they've been to their 4th booster shot already. Think we're going there?
Yeah. Yeah, it's a good question. I think we probably are headed in that direction. We have the U.S. has closely looked at practices around the world regarding vaccines and boosters, and it is, I would certainly think that CDC will be addressing that issue of a 4th booster here very shortly.
So
Okay.
if someone got infected once, can they test positive again for COVID?
Absolutely, it is very possible to have reinfections, and so we've had people that have been reinfected 2 and 3 times, after a previous infection, and so it's definitely possible to get reinfected.
The tricky vaccine is really not vaccine. This disease is really tricky, isn't it? And it just keeps bouncing around and coming back with some people, and very frustrating to say the least.
Yeah, the viruses, especially these respiratory viruses like this, are extremely exquisite in their ability to reproduce and to do what they need to do, which is make more virus. And this coronavirus in particular is very adept at changing and avoiding and being able to circulate. So it's done its job very efficiently.
Yeah, in your bank of knowledge, what can you tell us about monoclonal antibodies, both oral antibodies, all sorts of things?
Yeah, so there are oral therapies and other therapies that have been approved by the FDA under their emergency use authorization program. Monoclonal antibodies have been available in our community. It's very limited, and so it's not an over-the-counter product. It's not something you can access without the assistance of your primary care provider. Some of the other oral therapies that have recently been approved under EUA show some promise. They need to be administered within the first 5 days of infection. They can be administered at home. Monoclonal antibodies and infusion therapy that you go into the hospital for, basically. But they do have some of these oral therapies. They're not been distributed yet. It is every time we have a conversation with the state health department about it, it is like on the cusp of being distributed. And they have a distribution plan that's similar to what they've used for monoclonal antibodies for these new oral therapies. But right now they are very, very limited, and they have some specific use guidelines for them.
Apparently, there are some new CDC requirements for isolating and quarantine. Do you have those at your touch?
Sure. Yeah. So the current guidelines right now for isolation and quarantine are this. Isolation, against I stands for ill. I learned that from my secret infection control practitioner that puts a bug in my ear. So it helped me remember that. But I is ill. Isolation means that you have the illness either through a positive lab test or you have the symptoms and been diagnosed. So you should, if you're ill, you should stay home for at least 5 days from the date of the onset of the illness. You should isolate yourself from other people in your household as best you can. And so we recommend people, if they have a separate bedroom, a separate bathroom, take your meals in your room. I mean, you need to be pretty strict about the isolation part. When you're out and about in your home, you need to wear a well-fitting mask. After 5 days, if your symptoms have improved and you have no fever, then you can go out and about in the community. However, you still must wear a tight-fitting mask for another 5 days.
Okay. What
If
about
you're
all these homemade masks? Okay,
right, right.
made out of cloth and all that. What's the deal here?
Yeah, so early on when we had a really limited supply of face coverings, it was we had instructions on how to make your own mask out of cloth. What we've learned now is those are really not very effective. In fact, they're the least effective of the face coverings. So if you think about it as a risk management tool, you're going to use the best tool that you have available to you. So if you have an N95 or a KN95, that's the best tool. If you have a 3-layer surgical mask that's well fitting, that's the next best tool. The least best tool is if I could use that term, is a cloth face covering. So Paul, if I could follow up on quarantine. Quarantine is similar to isolation, but you've only been exposed. So you're actually going to watch to see if you develop symptoms for COVID. So the recommendations for that are you need to wear a tight fitting face covering for at least 10 days. Yeah, you should stay home for the first 5 days, except if you've been fully vaccinated and boosted. If the boosters are available to you, you do not need to stay home, but you still need to wear the face covering. You still need to watch your symptoms.
Okay. Our final
Yeah.
breaks here. You're
Yeah.
listening to Health Matters with the Medicine Center Pharmacy.
Thank you.
Okay, we're back to our final segment of the show. You're listening to Jim Adams, Health Commissioner from Canton City Public Health, and we will talk more about Corona.
So Jim, one of the nice things about having you guys down the street from the Medicine Center in Canton is that you're right down the street and you've been a great resource in the community. Can you give our listeners some quick tips on where they can find more information about the Canton City Health Department and, how you can help them get the answers they need in a timely fashion and answers they can trust?
Sure. Well, first of all, we do have some information on our website for those that can access the web. Our website is cantonhealth.org. That's all one word, cantonhealth.org. You can always call our nursing division. We have nurses that are available to walk through any particular questions you might have. And the number for that is 330-489-3322.
All right. And, I think that we all probably have, at least the healthcare providers, we all seem to have the health department's websites bookmarked and the CDC's website bookmarked. Any particular areas on the CDC site that you think are helpful for the public? I mean, I know sometimes it gets really complicated because there's a lot of info there. Any tips you can share with listeners?
Yeah, the search term that I generally use is CDC isolation and quarantine, and that will take you to the main CDC page for isolation and quarantine, and it is updated fairly frequently. It did take them a few days to do updates after they made their announcement about the reduction in the isolation and quarantine period, but the page now is current with the current recommendations. The other search term I use is CDC vaccination recommendations for COVID. And that one also takes you to the COVID vaccination page for recommendations. Those are the two of my main go-to pages. The other one, if you're kind of a numbers person and like those kinds of things, is they do have a data tracker that is very, very helpful. You can drill down and get data specific for Stark County. And if you do a search for CDC COVID data tracker, that'll take you right to that page. And that's pretty interesting to follow.
Interesting. All right. Well, thank you for that. Can you speak, are you willing to comment on how things are going with the COVID testing at the fairgrounds and share with the community the take on that?
Sure. Yeah, actually, I got a message right during the break about the fairgrounds. It has gone quite well. They do have an availability for walk-in appointments, no appointment necessary. So for those that want to get tested at the temporary COVID testing site, no appointment is necessary. And however, if you have registered for an appointment, they'll get the expedited test. They'll kind of move to the front of the line, but there are plenty of times available. Just go to the fairgrounds at Gate A on Wirtz Avenue, and the availability is from 8 till 1:30 p.m. Through today. Next week, they'll reevaluate kind of where they're going with the testing, and we'll provide updates about that on Monday.
All right. Well, very good.
I know most of the pharmacies in the community are giving the vaccines. Is the health department still doing this downtown?
Yeah, that's a good question. And here's a fun fact for you, Paul and Brad. The majority of vaccines, COVID vaccines delivered in our community are by pharmacists. So approximately 76% of the total number of vaccines that have been administered in Stark County have been through pharmacy. So our pharmacy partners are significant in the provision of COVID vaccine, and I'm assuming flu vaccine and other vaccines. So thank you very much for making that available in our community. By expanding that to pharmacies, you basically have an opportunity in almost every street corner to get a vaccine for a vaccine preventable disease. And that's very, very helpful. So thanks for that. Yeah, we are still offering our vaccination clinics for folks that want to do that. We have a pediatric clinic for those 5 to 12 on Wednesday afternoons. Right now, we are at the Malone East Campus site, and you can schedule that on the Ohio Department of Health's Get the Shot website for scheduling that. We also have an adult clinic from 9 to 2 o'clock on Thursdays at the same location. You should watch for what we're contemplating moving that location in the next few weeks. So we'll have information on our website about that. But for the next couple of weeks, we're still at that location.
Do you have any idea how many vaccines have been injected here in the county, or
Oh, wow.
Are those statistics out there? I don't know.
They are. I'm going to say that we at the city health department, we've given over 20,000 injections ourselves. Yeah. About a little more than 60% of the population in Stark County is fully vaccinated. I haven't looked at the numbers yet today. That might be a little bit off. But we're still under the target. We want to get to at least 70%. But we do track that, but the numbers are approximate because they change daily.
Man, that's crazy. 20,000. I love it.
Yeah. At least 20,000 for we ourselves. Yeah.
That's a huge number. That's 60% though. That's really good.
Of eligible. Yeah.
Yeah, that's great.
Could be better.
Are you doing any clinics like in the senior citizen high rises or anything along that line?
We have done testing in those facilities early on. We partner with Altman Hospital. They have a mobile operation that has been very active in the community. And so we work together with the Altman mobile folks to vaccinate in these much smaller venues, such as high rises, churches, and other community centers.
How challenging is it for you to keep up with all the other jobs that you do at the health department? I'm thinking bed bug outbreaks and Lord knows mosquitoes and everything else. I know it's winter, but I just, I guess I sympathize with the role you guys all play, given it's like a whole nother level of attention to detail you have to provide and do everything else you have to do.
Yeah, so that's very interesting. And the fact is that you can't keep up with everything. So there are some things that we have to put on hold. For example, we used to have an adult travel clinic that did, vaccinations for hepatitis and things like that. We have not been able to do that throughout the pandemic. For a while, we did not do childhood immunizations at the office. We are doing that now. But there are just frankly not enough hours in the day. So we have to prioritize. And some things are just not getting done. And that is very worrisome because there are still continuing issues in the community that need addressed. And they need the help of the health department to do that. And in some cases, we're just not able to do it.
Well, I can only imagine keeping up with everything has been a challenge. And I think we've all revisited how you prioritize things. It doesn't always meet everyone's need, but we try to do the best we can. So. So we're coming up with just about 5 minutes left.
Sure.
Do you want to kind of give Jim a summary of the state of Stark County, if you will, and Canton City and what you see? And maybe we can just catch people up who just joined the program and make sure they've got the most up-to-date info. Yeah.
I actually, while you were talking, I looked up the current rates on our dashboard, on the dashboard that's available to me. And in Stark County, we have 22,423 people that are at least started their vaccination. In Stark County, we have 206, a little over 206,000 have completed their vaccination. So that's 55% of the eligible population has completed their vaccination. The majority of those are over the age of 55, but the ages of 5 to 9 is very promising in that 12% of that age range has been vaccinated, eligible in that age range has been vaccinated. So that's very good. About 70, as I mentioned before, 72% of those vaccinations are provided by pharmacies. So by far the largest provider of pharmacies in our community. So, yeah, so, the things to remember are, one is vaccination is important, and vaccination is the number one best strategy we can use to help prevent a serious illness for COVID. The second one is to stay home when you're ill. So as we mentioned about the symptoms, these symptoms that Omicron presents with can be very mild to even, ones you don't notice. And so if you are feeling off, I've heard people talk about, I feel off, I have a little scratchy throat, my nose is runny, and then they eventually get a test or something and it's positive for coronavirus. So these symptoms are very mild. So really, you need to stay home initially when you're ill. If you're not able to get a test, stay home for the full 5 days. And that's going to help prevent your family. That's going to help prevent your coworkers. It'll help prevent the spread of these respiratory illnesses in the community. We mentioned before about testing if you can, but we do know that testing resources are limited. So if you can, that is a good tool. And also wear a well-fitting mask when you're out in public. So, while there's a lot of detail, there's a lot of, variations within some of those recommendations. The core recommendations are just those: get vaccinated, stay home when you're ill, wear a mask, and get tested if you can.
Very good.
How much staff do you have to administer? Are you using, I noticed the military is running around here doing some things. Are they working with you too or not?
We're not using the National Guard in our office. We do have some additional staffing that's been provided by a contract with the Ohio Department of Health. So we've had, some people term them travel nurses, but they're agency nurses provided by a staffing agency. So we have 2 staff nurses that are provided by the staffing agency that do exclusive vaccinations, and they also do case follow-up calls for us. We also have a couple of individuals provided by an organization called the CDC Foundation that are doing some epidemiological work and a school liaison. So that's been pretty helpful. Other than that, we've been using about half of our staff to manage both our clinics and our calls for new cases, which is around 30 people.
So are you anticipating need more people, or what's your thinking right now?
Oh, I think that as this current wave washes over us and we change some policies and practices relative to how we're following up with COVID, we'll probably need less people.
Interesting. What's the new variant called? I forget. I think I heard it the other day. But...
Yeah. Yeah, if you think about it, Paul, it's pretty amazing when the system for identifying these is extremely sensitive. And, with the ability to do genetic sequencing, very quickly, I think with good surveillance, and that's where the effort needs to be, is this good surveillance. We can take action based upon this surveillance data pretty quickly if we have the information. So, every time you see the news, of course, picks up on these variants, and the headline is always negative. But the positive part is that we're picking up on the variants, and we're understanding that, there might be some changes, and we can adjust our practices based upon that information.
Okay, I think it's about out of time here. Okay, so Jim, thanks very much for coming on the show today. We learned an awful lot. Jim Adams, Health Commissioner for Canton City Public Health. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, and January Appraisals and Liquidations. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC. Thanks again, Jim. We really appreciate it.
Thanks,
My
Jim.
pleasure. Thank you.